Mental Health America of Hawaii for the month of March. We have an exciting program today. We are going to learn about the Makani, the Hawaii Resiliency Project. This is an outreach project that has been new to the island to help with those who've had challenges from COVID-19. Today we have a group of folks, but I only have one of the introductions, so I'm going to introduce Michelle Ishiki Navarro first, and then she can introduce her team. Michelle is a licensed social worker and a substance abuse counselor and an internationally certified alcohol and drug counselor. She specialized in training and treating those impacted with addiction-related issues, homelessness, incarceration, and domestic violence. Michelle has worked in a variety of settings, including outpatient and residential programs, the houseless community, as well as assisting offenders in transitioning back to the community. Her passion is working alongside individuals whose lives have been negatively impacted by substance abuse issues, trauma, and incarceration. Michelle has also done extensive work in jail and prison settings on Maui and on Oahu, and she believes in empowering individuals so that they may connect with their families and with their communities. And with that, I'm going to turn it over to you, Michelle, and you can introduce the rest of your team and we'll move with the presentation.
Aloha everyone, I'm Michelle Navarro Ishiki. I am the team lead for the County of Maui for the Makani Hawai'i Resiliency Project. With me today, I'm sorry Danielle, that was a mouthful. I'll try to cut it down the next time. And I actually did cut it down. And alongside me, I have a couple of my colleagues, Michelle Chow. She is also a team lead. And I have my co-team lead, Catherine Chan. So Catherine is just along for the ride today to see what it's about as she is moving up. Michelle, you want to share a little bit?
Aloha, my name is Michelle, and so as she said, I'm the team lead on Oahu, and we are excited to share about our project, Makani. We've been up and running since the middle of January, and we have teams on each island, 2 on the Big Island and 2 on Oahu. And as we've worked to get the word out, we have created a website, which we're really excited about, kumakani.org. And then part of that website is another piece that we're really excited about is we're providing Zoom groups. So it's been a while, it's taking a while to kind of work out the glitches with the call center, but you can call us through Hawaii Cares and ask for the COVID crisis counselor. And we're there to help anybody from keiki to kopuna. So I could
start off with our presentation of the PowerPoint. Michelle, you can start on that one.
Am I sharing the PowerPoint or is
no? They're gonna share it.
Okay. So as the PowerPoint's coming up, I just want to share that we have realized that through this COVID crisis that it has affected everyone differently. And so as it has affected everyone differently, we've tried to reach out to different communities. And so you can call the 1-800-753-6879 and ask for a COVID crisis counselor. And this is funded through FEMA and SAMHSA and funneled through the Department of Health. And all of our teams are working together. And so we meet regularly. Go to the next slide. So we are working for CARE and CARE Hawaii. And CARE Hawaii, of course, is also on most of the islands. And they also provide mental health. But Makani, you know, is working on each island. And we have tried to look at what each island needs are. Maui So that's why each team has focused on reaching out to their own communities and looking what the needs are. And one of the things that we wanted to, you can go to the next slide, to emphasize is that it's non-judgmental, it's anonymous, and we're trying to reach out in a lot of different non-traditional ways. So we have the crisis, we're utilizing the SAMHSA and the FEMA crisis counseling trainings, and all of our counselors are trained. It's anonymous, and we're reaching out through as many different ways as we can, through Zoom, calls, emails, and reaching out to our communities to see what the needs are, doing presentations like this. And as well, we're providing services. We have keiki groups, we have teenage groups, we have some self-care groups that are all on Zoom that you can reach, that you can sign up for through our website. And you can go to the next slide. So as I said, we are reaching out to families, keiki, kupuna. We're reaching out to agencies. Our counselors are reaching out and trying to do presentations like this to as many agencies that will allow them. We're doing, so we reached out to any kind of agency that we can think of. And as we do that, we ask what the needs are for the community. And if you look on our website, you can see a wide array of Zoom activities. We have some kupuna activities that are crafts that might be more inviting for kupuna to attend. And then as they attend, they can talk about some issues and concerns that they might have. And a lot of it is just offering support. And we also can refer them to other agencies. If you look at our website, we've tried to train our counselors to have as many resources at their fingertips to give those folks that call in so that they can help them in what other issues that they have. If you can go to the next slide. So as we work, here's some samples of some of the groups that we have. We have a keiki talk story, we have yoga, we have a mindfulness activities on Saturday, we have creative writing. And one of the groups that just started last week is a talk story about insurance. And one of our counselors has a wealth of experience on how to navigate insurance, health insurance. And so she's been able to help with that. We have women's groups, and we are creating more groups as things come up. We are creating to kind of look at, for the teenagers, we're doing a makeup and hair group. And then as we provide that Zoom group, then the counselor can, talk story and see what kind of supports the participants might need. And again, it's a non-judgmental, easy access way for people to come in and get support and see, and then the counselors can maybe provide other means of support as they come up. We are also on social media. So we post regularly. These are the groups that our Oahu counselors, the East Oahu counselors are providing, but each team is providing different groups. And like the Kauai group is doing like a craft activity, and Mommy's group is provided by some of the Big Island groups. So there's a lot of activities, and we'll post those on our social media and Instagram. So you'll find us either on the website, on Instagram at Makani Hawai'i, or on Facebook. And if you just call in and you can't remember any of those things, if you call into the crisis to Hawaii Cares, you can always just ask that way as well. Next slide.
If I may share, I'm going to just jump in real quick here, Michelle. So our number again is 1-800-753-6879. We are working collaboratively with the Department of Health and utilizing the what once was the crisis line, which is now the Hawaii Cares line. So when you do call that number, if you ever should, or if you know anyone who needs to, 1-800-753-6879, do request specifically a COVID crisis counselor. I wanted to stress our hours as well are Monday through Friday, 4 to 9 p.m., and Saturdays and Sunday, 9 a.m. to 9 p.m. Thanks, Michelle.
And as she went over the details and those important details about when we're available, it's also important to acknowledge that we do have a number of different speakers. So we have Tongan, Samoan, Cantonese, Mandarin, and
Palauan, Hawaiian, Vietnamese, Pidgin English. We always got to throw that one in.
And if you want to speak to a counselor on a specific island, you can also request that when you call in, because that can be done and we can transfer that. And if another way to get to Kumakani is to email us. So if you were to just email maui@kumakani.org, you could do that. You could email east.oahu@kumakani.org. So we've tried to think of any way you could to reach us. Next slide. So this is kind of a brochure. Oh, here, look, right there is all the email addresses for you. So you can see all of those. And you could email us, and we have lots of printed material we have that we could email out. On through this brochure. And again, we just want to stress that it's for anybody, keiki tu kupuna. It's anonymous, non-judgmental, and free. One of the comments for one of the groups that was provided was they were surprised that this was a free service that we're providing. The addresses you can see are on the slide, the PowerPoint slide. If you look on the bottom left, you can see the emails and there. So
let me just share it. We tried to keep it as simple as possible when they were created. So Maui would be Maui@kumakani.org. Oahu has two different sites. They're listed on there. Kauai would be Kauai@kumakani.org. So specifically for Maui, it's Maui@kumakani.org. And that's how that's how it was created, so that everyone is able to have access to it and it be relatively simple for you.
Great question. So I think there's a couple more slides, but this is brochure we can email out. You can see this information on our website and also on the social media. So we can go to the next slide. And if you would like to, this tearaway flyer, we can email this out or we could mail it to you. And it's a tearaway that maybe could be posted at any of your, someplace that might have people that might need it. So please feel free to email us if you want any of those. Again, I want, so that's it. You could just email maui@kumakani.org and that could be mailed to you. And we can go to the next slide. So again, this really just shows all the areas where you can reach us. There's so many different ways. You can check out our website at kumakani.org. And the website, if you have a chance to check it out, it has a ton of resources for each island. So the counselors have worked to provide a lot of resources on each individual island. You can call us and ask for the COVID crisis counseling. You can Facebook us, you can Instagram us, you can Twitter us. So we're trying to be as accessible as we can. And then you can sign up for our groups through the website. And some of our groups we're posting will just have the Zoom login information there as well. So maybe we can do one of those poll questions. Michelle, what was the first poll question that you had?
I think we were good. Okay,
Or-
Amanda has created that.
So well, maybe the first one we could do, Amanda? If
Sure. I think we put them both up at the same time, so they're both going to pop up. But Dr. G, since you have host privileges, would you mind launching that poll for us?
Well, that poll is coming up. I wanted to talk a little bit about the counselors. So we have counselors that, we have a wide array of counselors varying in age from young adult all the way to seniors. So as we're reaching out to all populations, we also have counselors that can identify with different folks. And that's kind of true on each island. We have a wide range of talents, and they have all been trained to help help any of the callers and help them access other things that they may need, other resources, and they're there to help them through any crisis. We can go, well, Michelle or Catherine, did you guys have anything to add at this time?
I'll share more specifically to Maui as we get through the main points of our PowerPoint. We do have, there's so many groups to speak of that we are doing, and although each island has a specific group, a specific time, it's open to everyone statewide. So that's the beauty of what we're doing here. A lot of our call center counselors have taken calls from Kauai, either the east end or Kona side of the Big Island, as well as Oahu. We have really been trying to put ourselves out there so that our community knows that we have an opportunity to assist you through difficulties, even if it's just someone that you need to speak with. A handful of our calls have been for people who just needed a place to sound off, feeling isolated, feeling lonely. So, you know, that's the closest we can get to in terms of being able to be some sort of support for our community members. So if you know anyone or any agencies, organizations, individuals, perhaps family members who could benefit from our groups, please send them to our website. They can email us. You know, there's some pretty cool things that we're doing in terms of group. I know for Maui, Catherine is on this, she's in this meeting as well, but she does a really fun group for kids, and it kind of targets right around the 3 to 7 year old age, and it's for parents who are cooking dinner and you just, you know, yes, kids are being zoomed out, yes, they're being meetinged out, but you know, if you need 35, 40, maybe even an hour, 60 minutes to cook dinner and just have the kids sit there, Catherine and Kelsey, our counselors on Maui, are doing a really cool presentation. They have interactive things to do during their group sessions that really helps to support our parents as they try to cook dinner. So, you know, think about friends or yourselves if you have anyone who, you know, could use this service, and then that way everyone can sit down and have your meal together. We have a kupuna corner. We're doing that on Wednesday nights. Tuesday nights. And we have Denise who does that group for us. Oh, here we go. Here's the poll. So I'll give you guys a minute to go ahead and look this over.
Maybe while they're doing the poll, one of the things I was thinking of with some of the groups was the drug and alcohol groups that we're providing. There's a couple of groups, different. Oh, look at this. Interesting.
That's awesome. So for those of you who responded likely and yes, please go ahead and go to our website and reach out to us, and we'd most like to support you. There was a question asked if we're able to do outreach. So we can send our folks out there to participate. We can put a table up. We can most certainly figure that out, how we can support your events out in the community so that we can let our community members know about our services. Thanks, Genevieve.
So there were two groups I wanted to talk about, and maybe Michelle can help me out with this. But one is who I know there might be women that have been struggling with domestic issues. So we do a special group with that. So if you wanted to be part of that group, to email maui@kumakani.org and we would give you the information to log into that. And then there's the drug and alcohol groups that are provided. I think Kauai is going to be providing one, and I can't remember. I know there's another island that is doing another support group with that.
So Maui as well will be providing, and it's not to, if I may highlight one thing, we are not here to replace any services that individuals are already receiving. We're simply here to enhance that. And Maui will be doing a support group. It's, you know, most of our sessions are kuka, talk story kind, you know, again, to enhance your already existing support services or support groups. So it will be Maui and Kauai. There's a question, how long will this program last? So what I tell people is I'm really hoping that our ability to knock COVID out will put us all out of a job. We really want to see this go away. However, our contract only goes through October 10th, 2021, and it's a pretty hard ending. There's no extensions beyond that. This is the way the grant was written by the federal government. So again, this contract will end on October 10th, 2021. We have, oh gosh, it's so hard to go through how many groups we have, but I do know that there's resume building. We have that available. We also have Kupuna Corner, I was saying, on Tuesday nights. Right now we have our groups going a half an hour. Michelle and I are doing our women's support group on Thursday nights, and because of the nature of group that we have, we don't put out what the link for the meetings are at for the women's safety. And I really love this because I think everybody needs support at some level or another. And with the uptick in domestic violence issues, mental health issues as a direct result of COVID-19, this group that Michelle and I have created has seen individuals who need the support, and so that's what we're here for. So you could also email oahu@kumakani.org if you'd like to participate in the meeting as well. Kupuna Corner Tuesday nights. Monday nights we have special spaces. It's for our special population. Again, just fun activities, a place to hang out, a place to decompress from the day. You know, I think the other wonderful thing about our program is that our services are free, no charge. And Michelle said it more than once, we're not here to judge anyone, and we're here for you. So there's a couple more questions here.
While we're getting to the questions, I am looking at the website, and there's also, I forgot to mention, there's a veterans group, and so that's something different. And we have been trying to reach out to our veterans to see so that we can meet their needs. There's a yoga, there's a teenage zone and college kokua, like how to help to apply for college. There's unemployment supports, mindful moms, keiki corner, caregiver ko'o, and talk story for teens, keiki time, writing therapy. You know, there's all kinds of groups. So it doesn't really matter which island you're on. All of our teams are providing it right now so that anybody, no matter where you're living, you could jump on and sign up through the website. So was there another question?
We just have Genevieve who's just giving some positive feedback. So thank you, Genevieve. Does anyone have any other questions? There's a Q&A box there. There's also a chat box, but if anybody has questions.
So as with anything that's starting up, I just wanted to share that there are some glitches. So if you try to get through to Hawai'i Cares and ask for a COVID crisis counselor, and there's a little bit of a wait, just be patient and get through and try to get through. We know when we've done some test calls, we're hoping it's better because we've tried to do more trainings with them, but we acknowledge that that's something that we're working on. But please try and continue to reach out to us. The counselors are waiting for calls. So.
I have a great question here regarding the groups. So I oversee Maui County, so our program does include Molokai and Lanai. So yes, we do offer for them as well. Thank you, Jamie.
Michelle, we have another question that's in the
Chat.
chat box from Cheryl, and she says, she asked, how long are counselors able to remain on the phone? Is it a time-limited call?
We try our best to help the individual as much as we can. We don't like to keep a timer on the call. If we do find that people need more support, then we will try to work with that individual to see if we can link them up if they need a CMO, a crisis mobile outreach, because we have had a couple of instances where we needed to stay on the phone just a tad bit longer to help the individual out. I want to say yes, but I'm going to say no, because none of our counselors will just end the call.
The other thing that some of our counselors have done is if the person is willing and wants a call back, we've offered them we would call back and check on them the next day, or to call back and ask for that same counselor. So those are things that have happened at our call center when somebody wanted a call back or we wanted to check in.
Everyone's asking some really great questions, and we're going to try our best to answer them the best that we can. I do want to stress the time again for our call centers: Monday through Friday, 4 p.m. to 9 p.m. Saturday and Sunday, 9 a.m. to 9 p.m. We do have the ability to have individuals leave a message. So that is one thing that some people may or may not want to utilize that feature, but go ahead and do it if you really want to speak with somebody. And our work is done for individuals who have been directly impacted by COVID-19. So that's the one thing that we will be helping you with. However, if you do need more assistance outside of those outside of that time frames, then go ahead and call the crisis line, and they will try to get you some assistance should you need it and we're not available for you.
Michelle, I have a question. So how big of a response have you received since you started this from the public?
We are just starting to see an uptick. In the first couple of months, we were really trying to get saturated in our communities, and now we're doing more of these types of platforms. So Danielle, I really appreciate Mental Health America for allowing us this opportunity. But we are seeing an uptick, Danielle. We would like to see more because there's so much of us available for you. And we know that COVID is still impacting our community. And Danielle, one thing I want to say is, some people may or may not know what demographic are at this time able to do the vaccination. So we have all that information readily available for our community to be able to share that information too, where you can get the vaccines. If there's food drives coming up, we try our best to have that information available for individuals too. So again, if you're utilizing the Hawai'i Cares number and you want that specific type of information for your, go ahead and ask for a counselor from that island.
Thank you, Michelle.
Yes, Cindy, it is a 1-800 number. It is our old crisis line. I'm sorry, no, it's not the old crisis line. It's what was formerly known as the crisis line is now known as Hawai'i Cares. Again, the number is 1-800-753-6879. And someone just asked a question too regarding our website. Yes, our website has been giving us a lot of glitches. Our counselors are working diligently to put the information up. So most links do take you to a general informational type of blurb, but we are working hard to get it. And I'm going to share with you that technology is such a wonderful thing, but it isn't always the best thing, because we have different sites statewide, only one person can be on at the same time. Only one person can be on at a time, because if we have multiple people on the site and we try to save the information, everybody else's information may get saved as well. So we're trying to have individuals put in information. And for Maui, we do our inputting on Mondays and Tuesdays. So we're trying our best to get our information up there. Sorry about that. Thanks for the information, Genevieve. I will reach out to Karen for the drive-through. Mahalo. I just love being able to answer your guys' questions. Just go ahead and fire away at us, and we'll continue to answer the best we can. I hope we went through all the slides for our presentation.
Yeah, the last two were just questions. I mean,
Oh.
yeah.
Okay.
And we want to thank everyone for the opportunity for checking us out. But please follow us on Facebook or Instagram or Twitter, and check out the website. When we find a new resource, like I will be uploading a new resource on more affordable internet for low income. So I'm going to try to get that up probably in the next 3 or 4 days, but that's a new resource. So as new resources come to us, we'll shoot them on the internet, on our website, and we'll also share that with our counselors.
So Genevieve asks, how are we engaging teams? We are currently looking for an audience to be able to do that, because like Michelle mentioned early on in the presentation, we do have young adults who are able to do this population. So Genevieve, I would really love, because you're the one who's asking like these great questions, if you and I could link up. I'll go ahead. You can just go ahead and email maui@kumukani.org, or you can email me directly. My name is spelled with 1 L.
Yeah, and we have been reaching out to school counselors, and we will continue to do that to get the word out. I think one group that I think might help reach out to the teen group is our makeup and hair thing that's going to be starting, if not this Sunday, maybe next Sunday at 6 or 7. So that's kind of a teen thing. We do have that creative writing, a mindfulness one, a yoga thing. So we're trying to be creative and think of different things, but I've been putting some special efforts in reaching out to any of the high schools and teachers and counselors. And if you folks have people that we could reach out to, we'll definitely do that.
Thank you for putting my email in there, Danielle. I will also put Catherine on there for Maui. She is my co-team lead. She'll be starting into her position next week. So I went ahead and put her email as well. And that is not a typo. My name does have 1 L and Catherine has an A, not an E. I feel like I might be. Anybody else has questions? You know, we do have, Michelle, please correct me if I'm wrong. We do have a group. Ooh, Julie, I would love for you to share that information on how we can reach out to teens. But Michelle, can you help me? We do have a group, and I'll go on our website, or I'll just email or text the team lead now, and I should have had this information available, but we do have a group that is meant for individuals who have mental health issues. So let me try and get that information.
I can jump in there. There's a talk story for teens, and that's Sundays 5 to 6 p.m. Then there's a teenage zone in college kukua that's 4:30 to 5 on Tuesdays. And then there was the mental health that you were mentioning. And let me see if I could.
What's the day and time of that one, Michelle?
The mental health one, I got it. Saturdays 1 to 2 p.m. Discussing the impacts of COVID, providing valuable resources, stress management, coping skills, financial assistance, and more.
And I just wanted people to know that just because we have these groups at these times, if these groups start to grow, we will branch out and provide more groups. We don't want it to get so out of hand that individuals will get lost in our groups. We're going to try and limit the amount of people we have in the group so that we can spread around more for our community. Okay, and I'm not the best at technology, so I realize I'm only messaging Danielle, but I'll go ahead and leave Catherine's email. Oh my goodness.
You just put panelists and attendees, and it'll go to everybody.
Oops. Okay, Danielle, I should have listened to you before I hit.
Okay.
So in our group, I'm known as the tech tard. Okay, that's why Danielle folks are presenting for me. I know Michelle could do it and Catherine could probably do it, but I'm not. I said, okay, here, you do it.
You got it now.
Any more questions, comments? Absolutely. Cheryl, I will most certainly send you folks some brochures. Would you like that by mail or email? They look nicer. I could send you more if you'd like it by mail. Let me know. You can email me, Cheryl. Oh, mail. Okay. Perfect. Will do. Would anybody else like anything mailed to them? Thank you, Danielle. I just saw your message.
Yeah.
So
Send us information. You know, there'll be a time sometime soon in the near future, I'm sure, that we'll be back out with our resource tables for the community. So we'd love to carry your information there. So yeah, mail it to my house, to my office at Mental Health America of Hawaii, Michelle. That'd be great.
thank you so much, Danielle. If any partner agencies that you folks know of, Danielle, on Maui or Oahu, please let us know, or any island. And we are more than happy to get out there and share. Oh, you folks, you know what I missed? Oh, this is such an important piece. We do a lot of groups. Yes, we're offering a lot of groups. However, if you're not comfortable to sit in a group, our counselors can sit with you one-on-one. And we can provide you whatever time you need. So again, what I like to tell our folks is we are not counselors per se, we provide support. Again, we are not there to replace existing support systems. We're here to enhance what you already have. So again, if you or any individual you know of are not comfortable sitting in a group, our counselors can sit with you and do individual calls or Zoom meetings if that's whatever your preferred modality is. We're more than happy to support you in that way. That was a really important piece I almost forgot.
So you're getting a lot of people suggesting groups in the chat, so you can, either copy that and pull it out so you have that information, Michelle or Catherine, and then you can get back to them.
Absolutely. I hope, Catherine, you're able to just keep notes for us, because I'm not good at that. Catherine is. I'll forget because Catherine is much younger than I am. I'm so grateful that we have been able to spend time with you folks. It's such a joy to be able to help our people, our community. COVID has impacted us in a way that I do not think, I know for sure that nobody was prepared for, and that we're still here and we're still providing services. Everyone who's in this meeting, that we are here wanting to take care of ourselves, wanting to take care of our community. So I commend each and every one of you, Danielle, Mental Health America, for the wonderful work that you folks are doing out in our community. Pre-COVID too, you guys have been doing some amazing work for our community members. So my hat's off to you folks for the wonderful job that you all do. I know you guys don't think of it as a job. None of us do, because doing this kind of work cannot be considered work. I mean, we do a lot of heart work in this field. So I just appreciate every one of you, and Danielle, appreciate you for having us on here to be able to share our information.
Thank you, Michelle. We appreciate you for coming. If you do have any more questions, anyone, you can send them to me. I'm going to put my email address in the box in just a second. We do have a list of our trainings that we do every month up on our website. I just put the link to there. So you're welcome to check on that. We're doing a lot of wellness trainings these days. Coping skills, where we can do it for a group. We're also putting on our mental health first aid and youth mental health first aid. And anything you would like, just contact me. Amanda, did you want to say anything?
Oh, just thank you so much for coming today and speaking about the huge variety of services that you're offering. It's so encouraging to hear that you are offering them, and I'm really excited to also help get the word out about these resources statewide. So keep doing what you're doing, because it's amazing.
You folks as well. Mahalo.
Okay, everyone, thank you for attending this month. Please look in our newsletter for who will be our April brown bag. We were discussing it this morning. We haven't made a decision yet, but once we do, we will put that up on the link that I had on the website. Again, thank you, Michelle and your team, for presenting today. You guys were wonderful. We appreciate the work you're doing with the Makani project. And I'm glad we got such really good interaction with our attendees, and further connections that you can work with on Maui. I think this is a really great opportunity for, as you said, so many of the people who have been affected directly by COVID-19 and their mental wellness, has been challenged. So thank you for all you do. Thanks for everyone coming today, and we'll see you again next month, okay? Aloha.